Bonjour tout le monde.
Good morning, everyone.
Afternoon, I should say. Aujourd'hui, nous allons...
Today, we are going to be hearing Dr. Tam, who is our Chief Medical Officer at PHAC, Dr. New, the Deputy Director of the agency, Minister Miller, Dr. Wong, and Dr. Wong will be with us virtually. We also have with us Patty Hadu, who will be able to answer questions, as well as Minister Anand, who is with us but virtually. I would, however, like to begin by reminding everyone of the important announcement made by Mr. Trudeau. Major General Danny Fortin will be leading the vaccination initiative from headquarters.
News that the Prime Minister shared earlier that Major General Danny Fortin will lead the vaccination logistics of the National Operations Centre. Madame la Dr. Tam.
Bon l'après-midi, bonjour.
Good afternoon.
353,097 cases of COVID-19 in Canada, including 11,799 deaths. Nationally, there are 60,375 active cases across the country. And over the past week, labs across Canada have tested an average of over 75,500 people daily, with 7.6% testing positive. The national average case count is now over 5,300 cases reported daily over the last 7 days. With continued rapid growth of the epidemic over many weeks in a growing number of health regions across Canada, the troubling rise in the number of people experiencing severe illness continues. Over the past week, there have been, on average, over 2,100 individuals with COVID-19 being treated in Canadian hospitals, including over 430 in critical care and 76 deaths reported each day. Large weekly increases in new infections are being reported in many jurisdictions, with the highest daily numbers being reported in provinces west of the Atlantic region. In particular, sustained high case numbers in Quebec and Ontario and rapid growth in cases in health measures and urging their populations to do everything they can to limit contact with people outside of their household. Ultimately, the concern is the same everywhere. Continued spread of COVID-19 puts a strain on healthcare and essential services and threatens to overwhelm our capacity to respond. We are all in this together, and impacts will affect all our well-being, which is why we are being called upon to take action. Models continue to forecast significant increases in daily case counts and estimate that there could be up to 10,000 cases reported daily by mid-December. Right now, we have a window of opportunity to act collectively with public health authorities to bring the infection rate down to a safer trajectory. Two things are being asked of us: to follow local public health advice as measures are introduced for controlling spread across the population, and to strictly and consistently maintain our individual protective practices to help prevent infection and spreading the virus. Stay home and self-isolate if you have any symptoms, even mild ones. Clean your hands frequently, maintain physical distancing, wear a face mask when around people outside of your immediate household, and avoid or limit time spent in the 3 C's: closed spaces, crowded places, and close contact settings and situations. As with our last effort to bend the curve, and more so now, this is not going to be a quick solution. Time together, we can take comfort in knowing that the sacrifices we are making today are for our tomorrow. Now is the time to plan holidays that are safer and still allow us to maintain our important traditions, finding new ways to celebrate, connect, and support each other. With resilience and resolve, let's focus on the things we can do, including doing our utmost to protect our families, friends, and communities. Thank you.
Bonjour à toutes et à tous.
Welcome, everyone. There have been 353,197 cases of COVID-19 in Canada, including 11,799 deaths. Nationally, there are 60,375 active cases across the country. Over the past week, labs across Canada have tested an average of over 75,500 people daily, with 7.6% testing positive reported daily over the last 7 days. With continued rapid growth of the epidemic over many weeks in a growing number of health regions across Canada, the troubling rise in the number of people experiencing severe illness continues. Over the past week, there have been an average of over 2,100 individuals with COVID-19 being treated in Canadian hospitals, including over 430 in critical care and 76 deaths reported each day on average. Large weekly increases in new infections are being reported in many jurisdictions, with the highest daily numbers being reported in provinces west of the Atlantic region. In particular, sustained high case numbers in Quebec and Ontario, and rapid growth in cases in Alberta mean that these three provinces currently account for almost 75% of daily cases reported nationally. All jurisdictions are implementing a range of public health measures and urging their populations to do everything they can to limit contact with people outside of their household. Ultimately, the concern is the same everywhere. Continued spread of COVID-19 puts a strain on healthcare and on essential services and threatens to overwhelm our capacity to respond. We are all in this together, and impacts will affect all of our action to reduce the spread of the virus. If nothing changes, our long-term models continue to forecast significant increases in daily case counts and estimate that there could be up to 10,000 cases reported daily by mid-December. Right now, we have a window of opportunity to act collectively together with public health authorities to bring the infection rate down and flatten the curve towards a safer trajectory. We're just asking us to do two things: follow local public health advice as measures are introduced for controlling spread across the population, and to strictly and consistently maintain our individual protective practices to help prevent infection and virus spread. Stay home and self-isolate if you have any symptoms, even mild ones. Clean your hands frequently, maintain physical distancing, wear a face mask when around people from outside of your immediate household, and avoid or limit time spent in the 3 C's: closed spaces, crowded places, and close contact settings and situations. As with our last effort to bend the curve, and more so now, this is not going to be a quick solution, but a test of our determination and our endurance. While now is not the time to gather, we can take comfort in knowing that the sacrifices we are making today are for our tomorrow. Now is the time to plan holidays that are safer and still allow us to maintain our important traditions. Finding new ways to celebrate, connect, and support each other. With resilience and resolve, let's focus on the things that we can do, including doing our utmost to protect our families, our friends, and our communities. Thank you.
I'd like now to invite Minister Mark Miller, Minister of Indigenous Services.
Merci Jean-Yves Coué.
Thank you, Jean-Yves.
Good afternoon, bon après-midi. We continue to see an alarming increase in COVID-19 cases across Canada and Indigenous communities. We've seen a number of outbreaks in regions that had fared well during the first wave of this pandemic. First Nations, Inuit and Métis in regions such as Manitoba, Saskatchewan, Alberta, and Nunavut are experiencing an active infection rate that is close to 4 times the total number of Indigenous peoples infected by COVID-19 during the first wave. This is exceedingly serious. To ensure Indigenous groups and communities have resources they need to successfully prevent, respond, and limit the spread of COVID-19, particularly in those 4 regions, we have recently allocated over $200 million in immediate funding. Just this week, we allocated $19.3 million for efforts in Nunavut to support the various priorities identified by leadership and communities, including support for vulnerable populations, support for long-term care homes, deploying additional staff in communities with outbreaks, strengthening mental health services, and additional isolation and screening spaces where needed. Nous avons également octroyé 120
We have also granted Alberta, Saskatchewan, and $61 million to support the First Nations of Manitoba and their response on the ground. We will continue to support the efforts deployed on the ground to ensure that these individuals, communities, and organizations have the necessary tools to contain the repercussions of COVID-19 for the health and livelihood and lives of Aboriginal peoples.
We are also approaching the 1 year since the Act respecting First Nations, Inuit, and Métis children, youth, and families came into force. This historic legislation was co-developed with Indigenous partners to reform child and family services with the aim of reducing the number of Indigenous children in care, as well as enable First Nations, Inuit, and Métis to exercise their jurisdiction over child and family services so that they can decide what is best for their children, their families, and their communities. In order to thrive and fully reach their potential, children and youth need to have solid supports and resources, strong ties to immediate and extended families, as well as ties to their home community and cultural connections. Sadly, this is not the reality for over half of all children in foster care, even though they only account for less than 8% of all children aged 0 to 14. But behind these devastating numbers, there are real children, real and terrible stories, and these stories shouldn't happen to anyone, much less than innocent children. The overrepresentation of First Nation, Inuit, and Métis children in the child and family services system has been described as a humanitarian crisis. It is a crisis, and anyone who has seen the groundbreaking reporting of Kenneth Jackson knows that this is an ongoing crisis, but it's a crisis that we must have the courage to address head on. That is why First Nations, Inuit, and Métis communities are best placed to determine their needs and ensure their children, youth, and families thrive. Today, Prime Minister Trudeau announced an investment of over $542 million to advance the implementation of the Act. It's an important next step for the full and successful implementation of the Act. It will ensure that it is funding First Nations, Inuit, and Métis groups to work within and across their communities to build strong foundations and support them in engaging communities and hiring experts to develop models and legislations. In addition to this funding, and in order to provide initial support, a first wave of funding totaling $12 million was already allocated to 26 First Nations and Inuit groups, which had identified an immediate need to begin their work and explore Indigenous-led children and family services delivery models. We will continue to engage and work with partners to identify needs for funding that support their jurisdiction over child and family services. We also need to recognize that the uncertainty that COVID-19 brings to youth that would normally age out of care during this time. To make sure that they get the support they need, we will continue to cover eligible costs for First Nations, child and family service agencies providing services to youth who would normally be aging out of care during this time, and do so as long as the pandemic lasts. Les enfants et les jeunes sont des symboles.
Children and youth are symbols of hope for a better future. They challenge us to do better, to think outside the box, to innovate. To thrive and reach their full potential, they need support and stable resources, but also strong family and community ties, including a strong connection with their languages and traditions. The overrepresentation of First Nation, Inuit, and Métis children in child and family services has been described as a humanitarian crisis. It is one. We must have the courage to confront this crisis, this systemic discrimination. The $542 million investment announced today, along with the Act respecting First Nation, Inuit, and Métis children, youth, and families, is an essential step to correct our errors of the past. We know that there is still work to be done. We will continue to work with our Indigenous partners to assess the needs with regard to long-term funding and to respond to these needs.
Nations, Inuit, and Métis children first, so that they can stay with their families and communities and grow up immersed in their cultures and have greater opportunities to thrive and reach their full potential. This is not a promise that I or the Government of Canada take lightly. There's no doubt that we still have a long way to go, but this is an investment, and it is a key step in the right direction. A step towards keeping our promise to Indigenous children and families and to unleashing the potential that I have no doubt will change our nations and our world for the better. Miigwech, Nakumik, merci Cho, thank you, merci.
Merci beaucoup, Marc.
Thank you very much, Mark.
Dr. Tom Wong, Chief Medical Officer of Public Health at Indigenous Services Canada.
I want to acknowledge that I'm on the unceded territory of the Algonquin people. This have been reported, and this compares to over 60,000 active cases reported in the general Canadian population. Sadly, there have been 30 on-reserve fatalities, with a case fatality rate that's a quarter that of Canada's. Canada has reported over 11,000 deaths. Nous reconnaissons.
We recognize the value of Indigenous-led access, collection, and analysis of data. This will contribute to supporting First Nation, Inuit, and Métis communities in the promotion of approaches that are culturally adapted and based on evidence. For example, we support the efforts made to reinforce the governance capacity of Indigenous peoples with regard to data. For example, the funding granted to the First Nations Information Governance Center for efforts tied to the fight against COVID-19.
The general Canadian population and in Indigenous peoples is heartbreaking. This calls for our collective efforts to listen to the elders, to redouble our public health efforts, to limit non-essential travel, practice hand hygiene, stay 2 meters apart from people not within our household bubble, wear a mask, avoid gatherings, stay home if we are sick, if we are infected, or if we are in isolation. And most importantly, be kind, support each other, and do everything we can to protect our elders. We are in this together. Miigwech, Nakumik, and Marcy.
Merci, Dr. Wong.
Thank you. As we were saying earlier, Minister Anand and Minister Haidu are available to answer your questions.
We'll start on the phone. One question, one follow-up, and we will then turn to the room. Operator, over to you.
Thank you. The first question is from, la première question est de l'INADIB de la presse canadienne. Please go ahead, à vous la parole. Oui, bonjour.
Question. Yes, my question is for you, Dr. New. Last week, on Tuesday, you told us that you were hoping that the great majority of Canadians would be vaccinated before the end of next year. I'm hearing an echo. It's somewhat troubling, says the reporter. This morning, Mr. Trudeau stated just an hour ago that he thinks that the majority of Canadians will be vaccinated between now and September. So I would like to know where this precision comes from. Is it your information? It's become even more optimistic than what we've heard from you in the past. Answer. Thank you for the question. Clearly, the objective is always to vaccinate, or at least to offer vaccination to the majority of Canadians between now and the end of next year. I was optimistic. I think that about a week or two ago, I made statements, and perhaps the Prime Minister was able to refine the information. It's a project with adjustments that have to be made along the way. But we now have support with the Major General Fortin, who's now part of our team. We're even better positioned now to organize ourselves for vaccination for Canadians. There are also unknowns. We are still in the approval process with our colleagues at Health Canada. They still have to revise all of the evidence, the clinical trials from Pfizer and Moderna, and We are also waiting with optimism. We're awaiting information about the other 5 vaccine candidates to see what the results are. The results have been good. We'll have to see if they're all approved. There might be a whole array of vaccines, and it's difficult for us to say what the timetable might be for the delivery of these vaccines because they haven't yet been approved. But overall, I agree with the Prime Minister. We're expecting that a majority of Canadians will be able to be vaccinated in the fall or towards the end of next year. Thank you. Dr. New is going to repeat his answer in English.
The schedule for vaccination, certainly we've always been sort of optimistic, cautiously optimistic about what the vaccination rollout will look like. I think I said about a week or so ago that certainly by the end of next year, we would hope to offer vaccination to the majority of Canadians. I think the Prime Minister this morning or today sort of elaborated further, and I think he mentioned maybe a date of September. I think it's all in the same ballpark. I keep using my sports analogies in the sense that right now it's a bit of a moving target. We have 2 vaccines which are very promising, but they're still in the process of, quote, going through the regulatory process. If all goes well and they are approved, then they're the first 2 out of the pipeline. What we also anticipate is that with the other 5 candidates that we have, if all goes well with their results of the clinical trials and the data coming in and so on, and they get approved, then we will have really what I say a suite of vaccines to be able to offer Canadians, because we do have obviously advanced purchase agreements for all of these vaccines. And with all that in play, it's still, I think, a bit of an unknown. There's lots of moving parts in terms of what the schedule are, delivery, et cetera, and so on. But certainly, I think a major addition as well that the Prime Minister announced today is with the addition of Major General Danny Fortin to our team, I would say, Team Canada, to hopefully, like I say, bring this all together, certainly focusing on the logistic aspects. I think I mentioned last week that the Canadian Armed Forces certainly bring a unique expertise in the field of logistics, and we're looking forward to having them on board.
Follow-up question? Yes, just to be clear, Dr. New. You're saying between now and September, September is still the summer. The end of September is still the summer, and the Prime Minister is saying that the majority of Canadians will be vaccinated by then. Answer: yes. I'm always in agreement with our Prime Minister. Technically speaking, we're continuing to work very closely with our counterparts in the provinces and territories. An awful lot of people are working very hard behind the scenes, and it is good to have an objective for planning purposes. We're targeting September, but we have to be realistic, and I could also say that yes, the end of December is out there, but if we can move more quickly, it'll be better for everyone.
Thank you, Doctor. Operator, next question, please.
Thank you. The next question is from La prochaine question est de Janice Dixon from the Globe and Mail. Please go ahead. À vous la parole.
Hi, my question is for Dr. Tam. Why did Canada update its guidelines on aerosol spread in November after other countries and international organizations?
So aerosol is, I think we have to recognize there's a range of droplet size when someone coughs, speaks, sing loudly. Aerosols are the smaller of range and can get suspended in the air for longer. So just to set the stage. And we have, since probably June, been advising on, avoiding and minimizing close contact, close spaces, poor ventilation, and crowded spaces as well. So really, that's the key, and also, of course, wearing a mask. So I think from that perspective, we've always recognized that there's always a range of unknowns, and that the public health advice had been provided as early as that point in time. there's much in the way of evolving science and knowledge. And so in the Canadian context, many experts have been discussing this for quite some time. And so as a result, one of the key updates is because we're about to move into a time when everybody is going to have to gather inside and not sort of stay, well, it's more difficult to stay outside. So the emphasis on doing as much as we can, just a longer duration of exposure and others, is the key. So that doesn't change. What we are also trying to do, we've given some preliminary advice, which is just make sure your HVAC is well maintained, open a window, go outside if you can, even in the winter. And in Canada, we can do that in the winter too. You can still go outside whenever possible, are the key advice. But we'll continue to work with experts who are more in the field of ventilation and update or get them to update guidance and approaches accordingly.
Janice, follow up? Janice? Okay. Operator, next question, please.
What? Perfect. The next question is from, la prochaine question est de Émilie Bergeron from Agence QMI. Please go ahead, à vous la parole.
Oui, bonjour.
Question. Mr. Trudeau this morning stated that the majority of Canadians would be vaccinated by September, but he also stated in English more than half of Canadians would be vaccinated by then. Does that mean that in September we're expecting that a little bit more than 50% of Canadians would be vaccinated, or are we thinking more about 90% or more? Answer, Dr. New. It's very difficult to talk about precise numbers. I think that the Prime Minister is optimistic. I am too. There are a lot of unknowns, as I outlined previously. Even today, we don't yet have approved vaccines here in Canada. The most important thing is to have safe and effective vaccines here in Canada, approved by our colleagues at Health Canada. With the approval, perhaps, of these two vaccines, Pfizer and Moderna, perhaps we're looking at delivery of some 6 million doses in January and February. And we're going to start offering vaccination at least, to our priority groups, such as vulnerable people in long-term healthcare facilities, perhaps essential workers, such as healthcare workers. Beyond that, it's difficult to say, because if we're talking about September or December, that's several months away. And as I also stated, we have 5 other candidate vaccines, and we have to see what's going to happen with the results of their clinical trials. And there's the approval process, etc. There are a lot of unknowns, as I say, and we can't give a month and a precise percentage of the population that would be vaccinated. Also, as I've previously stated, it's a good step forward, and we now see that we will have the support of our armed forces with Major General Danny Fortin. This is a good step. He's now part of our Team Canada, and he will help us respond to all of the logistical challenges, because close cooperation with our counterparts in the provinces and territories, and also the leaders of Indigenous organizations. So all of the players at all levels of government are on board together. Thank you. Follow-up? Yes, question? Question for Dr. New. Yesterday, you stated that it was optimistic, your projection that the great majority of Canadians would be vaccinated between now and the end of the year. So what have you to say about Prime Minister Trudeau's projection announced this morning that it would be the majority of Canadians before September. That's earlier than what you put out there. And you qualified your statement as optimistic. Answer. I believe that what the Prime Minister stated this morning was good because it's a target. There are an awful lot of people within the federal government and in the provinces and territories who are working on this. If the Prime Minister set September out there as an objective, that's fine because we're continuing to work hard so as to be able to offer vaccination to the majority of Canadians. So if it's September or December, for me, it's just a matter of months. But we do have to pursue our efforts now.
We'll now turn to the room, starting with Mackenzie.
Hello, everyone. Mackenzie Gray from CTV News. First part of my question is for Minister Hajdu and Dr. Tam. Was there any consideration to use either the GlaxoSmithKline plant in St. Foy or the Sanofi plant in North York to produce vaccines domestically? And in the same vein for Minister Anand, why did none of the 7 vaccine contracts that we have any option for Canada to use the IP that the vaccine companies have had to domestically produce vaccines once we get to that capacity?
I think I'll start and then turn to Minister Anand. Thanks for the question, Mackenzie. And I think the Prime Minister said it well when he described the loss of biomanufacturing capacity in Canada over the past several decades. And of course, given that, we knew that we had to be aggressive in securing options for Canadians of vaccines that would represent a variety of different kinds of vaccines and also a variety of different manufacturers. And we didn't do that alone. We used the Vaccine Task Force to guide our work. In fact, these are hardworking volunteer Canadians who are volunteering to help their country. They're experts in pharmaceutical industry, in virology, scientists and researchers that are providing advice to Canada. And that's why we're so well positioned with this portfolio of very diverse vaccines, but also very promising ones. In fact, we were the first country in the world to have all 3 that are showing effectiveness now under regulation in the world. So and now there are other countries that are reviewing all 3, but we were the first country in the world to have submissions from those 3 companies. It just, I think, speaks to the quality of advice that we've received from the Vaccine Task Force. And I'll turn to Minister Anand for the rest of your question.
Thank you so much, Patty, and thank you for the question. When we entered into agreements for vaccine candidates in August, September, and October, based on the recommendations of the Vaccine Task Force, we of course took into account Canada's production capacity. One of the key criteria involved in the negotiation of the contracts was what would provide Canadians access to vaccines as early as possible. While we explored the possibility of domestic manufacturing with a number of vaccine developers, the quickest path to supply at the same time, Canada also made significant investments to rebuild our biomanufacturing capacity, for example, by investing $126 million into the NRC's Royal Mount facility, as well as in Medicago and Vito Intervac. So I'd like you to think about it as a 2-track process. First, ensuring that we have a diverse portfolio of vaccine candidates, which we have now secured with the most doses per capita of any country in the world for Canadians. And second, to, at the same time, bolster domestic manufacturing, make sure we are investing in domestic facilities so that we are not precluding the domestic option, but we are ensuring that Canadians have access to vaccines as soon as they are approved by Health Canada. Thank you.
Many other countries have been able to outline quite clearly the delivery date for vaccines. So for Minister Anand, in the contract with Pfizer, can you tell me the earliest date that Canada could receive a vaccine? And if you can't tell me, why did we sign a contract that cannot give such basic information out to Canadians?
Well, thank you for that question, and I want to make sure that we put these deliveries in context. We should and must think about the inoculation of all Canadians, not only the first Canadian. And that is exactly what the Prime Minister was suggesting in his remarks this morning. Having said that, and as a former professor of contract law, I can assure you that we put in place contracts with Pfizer and Moderna and the other suppliers that indicated once we have Health Canada approval, deliveries will start as soon as possible. The most important thing to remember, and we've been consistent about this at the outset, is that we can expect deliveries in the first quarter of 2021. And we put contracts in place with these 7 developers to ensure that Canada has the greatest access of any country in the world, the most diverse portfolio of vaccines, in order to ensure that Canadians are well placed, and indeed now better placed than any other country, for access to vaccines. And in terms of your question regarding a precise delivery date, I want to indicate that it is very important to remember that we put these contracts in place, recognizing that there may be uncertainty around the timing of the discovery of a vaccine, which we are still waiting for, and the finalization of approval from Health Canada. Those are 2 buyers, me included, almost daily with our suppliers to ensure that when Health Canada approval is forthcoming, we can then roll out vaccines to Canadians. This is a complex. We'll make sure that we have vaccines in place in Canada once Health Canada has provided its regulatory approval. Thank you.
Thank you, Minister. David?
Hi, David Thurton, CBC News. Dr. New and the Prime Minister have both said that they are hoping to vaccinate the majority of the Canadian population by the end of next year. So, Dr. Tam, can you tell us what level of vaccination do we need to see in Canada to protect Canadians against COVID-19? Is it 50%? Is it 60%? What is the success rate? What's the uptake rate that you need to see?
There's 2 aspects to the objective of immunization. Obviously, the first is to protect the individual. So some of the data that will be submitted to the regulator is about the effectiveness and safety for the individual that's getting the vaccine. As far as I know, we will not necessarily get any data about the effectiveness of the vaccine against transmission to someone else. So that's another kind of information that would be required. So I think, and the immunology, the immunity of the human body to both the virus and the vaccine is still being studied. Having said that, number of people who would get the vaccine, that you might be able to protect others. So that's the concept of herd and community immunity. I don't think anyone has an actual precise number for that. There's all sorts of modelers who are sort of projecting different levels. In general, you just want as high as possible. And it depends. Every vaccine has a different characteristic. And we don't know enough about the vaccines coming out as yet. So that would be the most sort of reasonable answer, I think. But the Health Canada and other regulatory threshold is not about a herd immunity threshold. That is about vaccine efficacy or effectiveness for those who are receive the vaccine versus those who don't. So I think we will come back to you with that answer. You hear lots of opinions, but I think right now we don't know the exact answer to that question.
So bear with me here. I've just got a text from my French colleague, Minister Anand, if you could repeat your question to CTV in French. But before we do that, just another question, and this is maybe for Dr. Tam or possibly for the Health Minister, Ms. Haidu. What's going to be the basis for deciding how many doses each province, each territory, each nation, or indigenous community gets? Is it going to be population size? Is it going to be the severity of the spread? Is it your head at this point?
Thank you very much, David, for the question. And these are exactly the conversations that are happening right now with health ministers. How we fairly allocate the doses, especially in the first quarter when we don't have very many doses. I think it'll become less of a pressing issue as we hope to receive more doses as the vaccines arrive and as they are approved. But certainly we are being guided, all of us, by the National Advisory Committee on Immunization, who, as you know, released some very broad general criteria about who likely should receive the vaccine first. Provinces and territories will also then do their own assessments within their own immunization programs about their own prioritization. In terms of the allocation of each province and territory, those conversations are ongoing right now with health ministers, so I can't be conclusive on that, but only to say that I'm listening intently, and obviously Canada will reserve some doses to vaccinate the populations for which we have responsibility.
Mr. Anand, if you could repeat the question to CTV's last question in French, please.
D'accord.
We have been consistent since the beginning. Canada has negotiated, has done its best in the context of the agreements we have negotiated to have access to COVID-19 vaccines. We have guarantees that the first deliveries will arrive in the beginning of 2021. And as science moves forward, as the regulatory process advances, and as the production of vaccines intensifies throughout the world, we will continue to cooperate with our suppliers so that Canadians have access to the vaccine as quickly as possible. Canada is very well placed with its vaccine portfolio that is the broadest and most diversified in the world. And as I outlined, we will continue to interact with our suppliers in order to obtain the delivery dates as early as possible, despite the fact that our agreements set out precise dates. We must take into account a certain number of variables that are involved, and this will determine exactly when Canada will receive the first doses of COVID-19 vaccine. For example, it depends on the increase of the ability of manufacturers to produce. It depends on the results of the clinical trials and the advancement of the regulatory process. This is why we are continuing to be transparent and responsible in the way in which we are dealing with the deadlines for delivery. And we don't want to precipitate any decisions. We rely on science because the health and safety of Canadians will always be our very first priority. Thank you very much. Thank you, Minister.
From Tonda, and we'll switch back to the phone. We have a hard stop at 1:30, so we might not have time to come back to the room after the next round on the phone. Tonda.
Hi, thanks. Tonda McCharles, Toronto Star. Before I get to something I want to ask, I just want to get some clarification on the answer to Mackenzie about asking the companies we've signed contracts with for permission to manufacture in Canada. Minister Anand, did you actually say that, I just want to make sure I understand it, that those companies, did they refuse you that permission to license to manufacture in Canada, and were they the ones that said, you're better off just buying it from us?
Listen, Chanda, thank you so much for the question. I want to be clear that we took an all-out approach in our contracting. We explored every possibility with these suppliers, including making sure that they knew we would be open to any option relating to domestic manufacturing as well as international agreements. Our approach was to put agreements in place for the greatest access, all countries in the world, to get an agreement with Pfizer. We were one of the earliest countries to secure an agreement with Moderna. In fact, the managing director of Moderna's Canadian unit yesterday in Reuters was reported to have said Canada is certainly one of the first countries to have an agreement with us and will be serviced very quickly. And then with regards to AstraZeneca, we are the first country that they signed with that did not have very important point to remember, that our aggressive approach to contracting, our aggressive approach to a multi-pronged negotiation with multiple suppliers at the same time yielded an incredible portfolio which will serve Canadians well in the short and the long term. 414 million doses in total will be in very vast number for Canadians if we choose to exercise our options. And I want to stress the incredible work of the public servants over the last 3 to 4 months, especially in the negotiation of these contracts that, as I've mentioned, have placed Canada at the forefront of vaccine procurement in the world.
Okay, I guess that's not going to be clarified. So I'll just move on to maybe vaccine hesitancy, I think, is something that you're all concerned about, and confidence in these vaccines that you're bringing forward. Given that a couple of them are the very new mRNA technology, and given that you're getting the military involved now, I don't know if you can talk about, do you foresee the military being involved in administering vaccines? And can you talk about what your concerns are around public confidence with that, not just that image, but the whole ability to receive vaccines, especially when we've got these very high-tech new platforms? Thanks.
So I think just want to emphasize again that we have a rigorous regulatory process. Many people have just heard about the results of these vaccine trials essentially through the media, and that's not how we evaluate vaccines. And so the regulator, and also in peer review, we would expect to see the data not just on the efficacy, but on safety outlined. Now, these phase 3 clinical trials are testing tens of thousands of people in each of them. So we will get a good idea about the safety of the vaccines as they go through regulatory approvals. After that, Canada also has a very robust foundation for detecting vaccine safety signals or reports, which are then channeled to the regulatory authorities, also through public health to the Public Health Agency, where we will review any kind of incident very carefully and take action accordingly, which means that we will be monitoring the effectiveness and the safety of these vaccines throughout their deployment as well. And so I think some of the, our engagement with Canadians, often through successive surveys or polling, has indicated that, yes, I'm sure they welcome the speed of which we're getting the vaccine, but they want to know that they are safe. So I think that's the really important aspects, and we need to be able to communicate what we find along the way with Canadians as we get that kind of data so that they can be informed. And so I think that goes a long way. And there are many ways of which we are also gearing up to increase communications to Canadians so that they have the information that they need. One is to actually equip healthcare providers so that they have the information as we have them, so that they can counsel their patients, whether they be pharmacists or health, physicians or nurses, so that they are equipped to provide that information, which I believe is really important. And there are other strategies also to engage different groups with Minister Miller and others to engage Indigenous communities as well. So that's really important to vaccine hesitancy. In terms of, the military engagement, right now, through Major General Danny Fortin, they are there to support us with logistics. So a lot of their skill sets are put to bear there. We have not received any requests specifically on other supports, but we'll be open to sort of evaluate them if provinces need further support for immunization. They've just gone through a huge influenza vaccine campaign. We know we've got the ability in Canada to provide, just in the last weeks, 16 million doses of influenza vaccine. These vaccines aren't going to roll out that fast. So there'll be very thoughtful processes put into place on how these vaccines are going to be administered. So I'm sure the Canadian Armed Forces is ready to help, but right now their skill set is put to bear on the logistics.
Overall, Canadians, I think, recognize we have one of the best vaccine systems, I would call it, in the world. And that starts right with the regulatory process. I think Canadians can rest assured that any vaccine that gets approved in Canada has gone through a rigorous review, and the safety and effectiveness have been proven. And so we would look at all of the childhood diseases in Canada, the coverage rates for the vaccine. We have a well sort of built-in infrastructure for the delivery of vaccines in general, including influenza. So now the new wrinkle is that with the COVID-19 vaccine, especially the two new candidates, as you mentioned, they are new technologies, and they have some unique logistical aspects in terms of obviously the cold chain. And that's where I think the Canadian Armed Forces can really bring value in terms of the logistics for the delivery of this sort of unique set of circumstances. But once that's there and they're actually delivered to their provinces and territories, certainly the expectation at this point and the planning will be that with the existing infrastructure, the actual putting needles into arms will rest largely with the provinces and territories as the way they have been for other vaccines. And certainly if we get other vaccines down the road that are sort of similar to the vaccines we're used to in terms of the cold chain being kept between 2 and 8 degrees Celsius, they would be delivered and administered with the existing infrastructure compared to all the other vaccines that we have at our disposal today. Thank you.
Thank you, Dr. New. On va maintenant retourner au téléphone. Impératrice.
We're going back to the phone now.
The next question is from, la prochaine question est de Ryan Tumulty from National Post. Please go ahead. À vous la parole.
Yeah, hi there. The NRC facility in Montreal, that was the initial funding that was announced, the $44 million that was announced early in the spring, was supposed to have a facility set up in November. I understand that was for the CanSino vaccine, which we eventually didn't go ahead with. But I'm wondering, it seems like the focus was maybe lost on the facility because now it is not scheduled to be ready until sometime next year. I'm wondering if you were getting regular updates on that facility, or if after the CanSino vaccine fell through, that facility was no longer seen as valuable.
Anita, would you like to answer the question?
Well, thanks, Ryan. Minister Baines led on this file with the Prime Minister, and the intention was to ensure, and it is to ensure, that we can do domestic manufacturing, $126 million to the Mount Royal facility to ensure that we can yield 2 million vaccine doses per month when it is up and ready. The understanding was that it would not be immediately available as a facility, and the intention is for it to be up and running. The issue of which vaccine would be produced there is not in any way resting on CanSino. We are still in negotiations with our suppliers as to which vaccine will be manufactured there, and that's part of our ongoing negotiations every day. Thank you.
Follow up?
Yeah, just as a follow or on another question, I guess. In your vaccine contracts with the 7 suppliers that make up this broad portfolio, was there any option that Canada did not exercise to potentially spend more to speed up our delivery of vaccines?
Well, thanks again for the question. I want to assure you that since the very beginning of these vaccine contract negotiations, we have left no stone unturned. We have made sure that we are aggressively pursuing the earliest delivery options. We are aggressively pursuing the maximum doses that the supplier would allocate to Canada. We are aggressively pursuing every angle relating to production. And as a result of those aggressive negotiations, we have, as you know, ended up with the most doses per capita of any country in the world, with very solid contracts yielding very strong candidates for Canada. As Minister Hajdu mentioned, we're the only regulatory body currently reviewing all 3 of the leading candidates. So Ryan, that is the state of the nation on the contracting process. Thank you.
Thank you, Minister. Operator, one last question on the phone. That's all the time we'll have for today.
Thank you. The next question is from La prochaine question est de Lawrence Martin from Radio-Canada. Please go ahead. À vous la parole.
Oui, bonjour.
Question. Yes, the question is for Minister Duclos. When we distribute the vaccine, if there are logistical issues in provinces like Quebec and Ontario, might the Canadian Army intervene to help out? Answer. Thank you very much. First of all, I'm not an expert with regard to logistics for vaccination countrywide. But what I know with regard to Quebec is that in Quebec, for a long time now, we've had a very robust system for administering vaccines that works very well. Therefore, we have every reason to believe that with the cooperation and support of the Canadian government, we will be able to deliver and administer vaccines in the best conditions possible. With regard to the Canadian Armed Forces, as you saw this morning, this has been in preparation for several weeks, several months now. The Canadian Forces will play a significant role at the National Operations Centre of the Canadian government, and as was the case with the CHSLD in Quebec, the long-term care homes, the Canadian Forces will always be there to help Canadians and Quebecers receive what they need in the context of the COVID-19 pandemic. We saw this with the long-term care facilities. It can take different forms. There is the material, logistical aspect, equipment, vehicles, even airplanes that can be used by the forces to support the Quebec government in the way in which, and at the time that the Quebec government wishes. There are also human resources. The Canadian Armed Forces, as we saw with long-term care facilities, have medical human resources that can also serve and be used for vaccination. But all of this must be done in cooperation and in discussion with the government of Quebec. Follow-up question? Yes, a final question. You talked about this in English. I'd like to hear you in French. Some provinces are much more hardly hit than others. Will the vaccine be approved on a pro rata basis? Or are there territories like Nunavut, for example, that might receive the vaccine sooner or first? Dr. New for the answer. Thank you for the question. We are still having discussions with our counterparts in the provinces and territories. Everyone received the recommendation or recommendations of our advisory immunization task force. And I think Quebec has already decided who in Quebec's population would be served in priority. It's a combination. We analyze priority populations. It's part of the discussion.
Time we have for today. Ceci met fin à la conférence de presse. I'm sorry. We really have to go.
Dr. Tam, can you stay for a couple more questions after ministers leave?
Sorry, that's all the time we have today. Sorry.
Thank you. Merci. The